Hi guys, welcome back to my channel. In today's video I will be discussing my acne, my battle with it, how I plan to combat it, as well as my skincare routine. So if you are interested, please stay tuned. Okay, so I've been struggling with acne for roughly about 4 years now. I just get really bad breakouts here and there. It's no like cyst acne or anything like that. Just bumps that appear, and sometimes blackheads, whiteheads, whatever, and the ones that you like pop and that I was popping. All of that, I definitely get those around my menstrual cycle, and just occasionally, just here and there. Some of my problem areas are definitely my cheeks, a little bit around my chin, as well as just my whole jawline, as well as my forehead. Because of those, my struggle with acne, I've also gotten a lot of scars from that acne and a lot of dark marks. So I, at one point in time, was taking the birth control that was prescribed to me by my dermatologist, and that definitely worked for me. It definitely cleared up my dark marks, as well as prevented breakouts from happening. But unfortunately, I have high blood pressure, and I know what 24-year-old has high blood pressure, but it's all genetics and it comes from my family. So unfortunately, it was passed down to me. So I had to stop taking the gas because it was affecting my blood pressure. So I stopped the blood pressure. I stopped the birth control roughly about 1.5 years ago, and I've just been winging it with just washing my face, toning and moisturizing it every day, and that's all I've been doing. And I've just come to a point where I just got fed up. I mean, the scars are like really bad. They just tend to get darker, it seems like. There just seems to be more popping up. The breakouts are just happening more frequently, and I'm just like over it. It's definitely affecting my self-esteem. I hardly take any selfies anymore. Like, what girl doesn't take selfies? And I mean, just like a blow to my confidence. So I scheduled a dermatologist appointment last week, and I went in to see what can be done, what can help me fade these dark marks on my skin, and what can help prevent breakouts for me. So my dermatologist, and I will leave her information below if you are in the Atlanta area and you are in the market for a dermatologist. She prescribed me two medications. I told her that I was at one point taking Yaz, however it was affecting my blood pressure, so I needed something that, something along those lines, but that wouldn't affect my blood pressure. So she prescribed to me this medication. It is spironolactone. It is just a little tablet that I take once a day. Pretty small. I don't know if you can see it. Pretty small tablet, so no problems like swallowing it or whatever. And I take that once a day. I take that in the mornings, and it is a water pill. So she said you will experience having to go to the bathroom more often. But I actually haven't experienced that just yet. However, I did just start taking this Thursday. Today's Monday, so it's only been a few days. But I got this medication. She said that it will help. It'll give me the exact same benefits that I was experiencing with Yaz, but just without the birth control part of it. And it would help me lower my blood pressure as well, which is definitely a plus. So she also gave me a ointment or cream to apply to my face, a topical. I'm sure a lot of, if you do have acne or dark marks and all that, I'm sure you've heard of Regimen. So she prescribed to me Regimen in the 0.025%. I believe this is the lowest dose, and I have the generic brand, which is the tretinoin cream. I apply this to my face at night after I wash my face. Just apply a pea-sized amount, just dot it all over, rub it in. A little goes a long way with this cream. You don't really need a lot at all. And yeah, just leave it on at night, and she said this will help with fading the dark marks, which is exactly what I need. I'm excited to see how well those work for me. I do plan on documenting, my growth and, the changes, hopefully, and do like an update once a month on my skin and how well it is. I know you probably can't see it from this angle, but I will put in some pictures of just how bad the marks are on my face. But I'm just gonna hop into my daily skincare routine and what I've been doing since forever, basically. So in the mornings and in the evenings, I use this Cetaphil daily facial cleanser on my face. I usually just wet my face with warm water in the morning before I apply this. I apply it with my fingers, just rubbing it through my face all around. This is for normal to oily skin. It removes excess oil without drying and rinses clean. I really love this stuff. It's non-comedogenic as well. My dermatologist recommended it years back, and I've been using it ever since. It just leaves your skin feeling really good. It doesn't dry it out at all. I love the lather that it gives you. It's clear, but it's very like creamy, and it it doesn't foam up, but it just gives you a really good lather to wash your face. And I apply that with my fingers, but I deep clean, I guess, with this acne-free brush. I know it's not one of those big name brand brushes, but I got this from Target for about $10 or $15, and it's been working just fine for me. I definitely get to feel a deep clean with this brush. Every time I'm done washing, it's like brown with the dirt and the buildup and all that that's on my face, the oils. But I can definitely tell that I'm getting a deep clean with this stuff. And it has a low and a high. So after I wash my face with that Cetaphil, I apply a toner. And the toner, my toner of choice is Dickinson's Original Witch Hazel Toner. Gently cleanses and conditions pores to maintain clear, smooth, and balanced skin without over drying. And this is 100% all natural. I really like this stuff. I've been using this stuff for roughly about 6 months or so, and I can definitely tell the difference in my skin. It just feels softer, definitely cleaner, because I know after I wash with my little spin brush and then I apply this with a cotton ball, there's still like some oil that it removes and some dirt on it that it removes, because I can see like the brown spots on the cotton ball. So I can definitely tell that this works. It doesn't dry my skin out at all. I get a healthy glow with this stuff. So if you are in the market for a toner, I highly suggest this Dickinson's Original Witch Hazel Toner that you can find at Walmart for like $4 or $5. My moisturizer that I'm currently using is this Neutrogena Oil-Free Moisture with the SPF of 15. So it does have sunscreen in it. I just apply this. Little goes a long way as well with this. Dot it all over my face and rub it in. Before I used this, I was using Cetaphil's Daily Moisturizer with SPF as well, and it works just as well. I can't really tell the difference in the two products. You know, it's just a lotion or whatever. So, yeah, if you're in the market for a moisturizer, this Neutrogena Moisture with SPF is pretty good. Occasionally my face may still feel a little bit dry, so I will add like lotion of some sort or aloe vera gel to my face just to give me some extra moisture. But for the most part, these products have been working for me. Of course, I still experience acne, so it hasn't been blocking breakouts or really helping with my dark marks. But just for overall, just, you know, cleaning the skin and moisturizing it and toning it, those products work well for my skin. Now for my skin type, I would say I have a combination of oily versus dry skin. Occasionally, more often in the summer, my skin will be oily, and of course more often in the winter, I experience drier skin. So definitely combination. I wouldn't say I would be more one than the other. But that is my skincare regimen, and those are the acne products that I was prescribed. So I'm looking forward to seeing how those work for me, because I am so tired of these marks on my face. I want to be able to take selfies, because I'm not like a makeup person. I don't wear foundation or anything like that. I don't want to cover it up because I feel like that's just, it's too much, it's too time consuming, and I don't feel like buying all that stuff, none of that. I just want to wear my face. So hopefully these products work for me. I can get my skin back to where it once was, sans these dark marks and sans the breakouts. So if you are interested in seeing how these products work out for me so that you may go to your dermatologist and get them or whatever, then please continue watching this acne series where I document the progress from here on. As always, thank you all for watching. That's all I have for you guys today, and I will catch you guys on the next video. Bye guys. Okay, so here are the pictures of my skin. This was last week. Before I went to the dermatologist, you can see the dark marks on my cheeks as well as the breakout that I experienced on my forehead near my menstrual cycle. Today's skin is shown here. The breakout on my forehead has dried out a bit. However, the marks are still very visible on both of my chins, as you can see here, as well as my other chin shown here. So stay tuned for the progress, and I'll catch you guys on the next video. Bye!